Hey everyone, and welcome back to the channel. Today, we're diving deep into a medication that many of you might have heard of or even been prescribed. Gabapentin. It's one of those drugs that seems to pop up for a variety of conditions, from nerve pain to seizures. So, what's the real story behind it? How does it work? What are its benefits? And what are the potential downsides you need to be aware of? We're going to cover all of that today, so you can have a more informed conversation with your healthcare provider. First things first. Let's talk about what gabapentin actually is. Initially developed as an antiepileptic drug, or an anticonvulsant, its main job was to help control seizures. But over the years, doctors discovered it was also incredibly effective for something else: neuropathic pain. This is a specific type of pain that comes from damaged nerves. Think of conditions like diabetic neuropathy, where you get tingling and burning in your feet, or postherpetic neuralgia, which is the lingering nerve pain that can follow a shingles outbreak. Gabapentin has become a go-to medication for managing this kind of chronic discomfort. It's also used off-label for things like fibromyalgia, restless leg syndrome, and even anxiety in some cases. So, how does this one medication do so many different things? It's a great question, and the science is pretty fascinating. For a long time, the name gabapentin made people think it worked directly on the GABA system in our brain. GABA, or gamma-aminobutyric acid, is our primary calming neurotransmitter. It tells our nerve cells to slow down and stop firing so rapidly. While gabapentin is structurally similar to GABA, it doesn't actually bind to the GABA receptors in the way you might expect. Instead, its main mechanism of action involves something called calcium channels. Imagine your nerve cells are like little communication hubs. To send a pain signal, they need calcium to enter the cell through specific gates, or channels, too. This influx of calcium triggers the release of other neurotransmitters, like glutamate, which ramp up the pain signals being sent to your brain. What gabapentin does is bind to a part of these calcium channels, effectively blocking them. By partially closing these gates, it reduces the amount of calcium that can enter the nerve cell. This means fewer pain-signaling neurotransmitters are released, and the overall volume of the pain signal is turned down. It's like putting a dimmer switch on your nerve pain for seizures. This same mechanism helps to calm the excessive electrical activity in the brain that causes them. Now let's get into the pros. Because for many people, gabapentin is a game changer. The biggest advantage is its effectiveness in treating neuropathic pain that often doesn't respond well to traditional painkillers like NSAIDs or even opioids. For someone living with constant burning or shooting nerve pain, finding relief can dramatically improve their quality of life. It can mean sleeping through the night for the first time in years, being able to walk without excruciating pain, or simply getting back to daily activities. Another pro is that gabapentin is generally not considered to have a high potential for addiction in the same way opioids do, which is a major concern in pain management today. This makes it a safer long-term option for many patients dealing with chronic conditions. It's also versatile. The fact that it can be used for seizures, nerve pain, and other conditions makes it a useful tool in a doctor's arsenal. Plus, it comes in various dosages, allowing for flexible treatment plans that can be tailored to an individual's needs, starting low and increasing gradually to find the most effective dose with the fewest side effects. However, like any medication, gabapentin is not without its cons and potential side effects. It's crucial to be aware of these. The most common side effects people experience, especially when first starting the medication, are dizziness and drowsiness. This is why doctors usually advise you not to drive or operate heavy machinery until you know how the drug affects you. Some people describe feeling a bit out of it or foggy, which can be challenging, especially if your job requires sharp mental focus. Other common side effects can include fatigue, blurred vision, and unsteadiness, which can increase the risk of falls, particularly in older adults. Beyond the more common side effects, there are some more serious concerns to be aware of. While the risk of addiction is lower than with opioids, dependence can still occur. This means your body gets used to having the drug, and if you stop taking it suddenly, you can experience withdrawal symptoms. These can include anxiety, insomnia, nausea, pain, and sweating. That's why it is absolutely critical to never stop taking gabapentin abruptly. Always work with your doctor to taper off the dosage slowly and safely. In recent years, there has also been increased awareness of the potential for misuse. When taken in very high doses, or combined with other substances like opioids or alcohol, gabapentin can produce a euphoric effect, which has led to it being misused. This combination is particularly dangerous and can significantly increase the risk of respiratory depression, where your breathing becomes dangerously slow. 2. Because of these risks, some states have reclassified gabapentin as a controlled substance to monitor its prescription more closely. Another important consideration is mental health. In rare cases, gabapentin has been linked to mood changes, depression, and even suicidal thoughts or behaviors. This is a very serious side effect, and if you or someone you know experiences any of these changes while on the medication, it's essential to contact a doctor immediately. Goal: always keep an eye on your mood and emotional state when starting any new medication that affects the central nervous system. If you're struggling, please know that help is available. You can always reach out to a crisis hotline or a mental health professional. So, let's put it all together. Gabapentin is a powerful and useful medication that provides significant relief for people suffering from difficult-to-treat nerve pain and seizures. Its unique mechanism of calming overactive nerve cells has made it a lifeline for many. However, it's not a magic bullet and comes with a list of potential side effects, including drowsiness, dizziness, and the risk of dependence and withdrawal if not managed properly. The decision to take gabapentin is a personal one that should be made in close consultation with your doctor. They can help you weigh the potential benefits against the risks based on your specific health condition, lifestyle, and any other medications you might be taking. It's all about open communication. Be honest with your doctor about your symptoms, your concerns, and any side effects you experience. They might need to adjust your dose, suggest taking it at a different time of day, or explore other treatment options if gabapentin isn't the right fit for you. Remember, the goal of any treatment is to improve your quality of life, and you are the most important member of your healthcare team. Your experience and feedback are vital to finding what works best. I hope this detailed look at gabapentin has been helpful and cleared up some questions you might have had. It's a complex medication with a lot to consider, but with the right information and medical guidance, it can be a highly effective treatment. If you found this video informative, please give it a thumbs up and consider subscribing for more deep dives into health and medicine. And as always, share your experiences or questions in the comments below. Let's learn from each other. Thanks for watching, and I'll see you in the next one.